World Glaucoma Week is initiative of the World Glaucoma Association to increase awareness among population regarding a very important eye disease called glaucoma. It's a potentially sight-threatening disease that is quite frequent. And it is very important for the population to understand that those people who are at risk for developing the disease, which includes people over 40 years of age, includes people with family history of glaucoma, myopes, people with high intraocular pressure, and people of Afro-American origin, have a great risk of having the disease. And all of them should have periodical checkups to diagnose glaucoma as early as possible. I have given all my professional efforts in teaching, research, and clinical to prevent visual impairment and keeping patients' quality of life. During these 30 years of work, glaucoma has really positively and very intensively influenced myself and filled all my activity. Dealing with glaucoma patients and interacting with them has taught me many things, particularly being patient, being constant, being meticulous, and also humble. It is very important to diagnose and treat glaucoma as early as possible. Glaucoma is the second most frequent cause of blindness in the world. It is an optic neuropathy that causes damage to the optic nerve, and it is an irreversible damage. So once it appears, it cannot be compensated. It is very important that patients at risk for glaucoma, those that I mentioned before, get checked for the disease, because most patients with glaucoma have no symptoms for many years, even decades, until the glaucoma is very advanced. Early glaucoma and treatment of the disease with medical treatment and or laser treatment and or surgical treatment, and many patients require different of those, is very, very important. But a very important message that I would like to give to patients is that in most cases, adequate diagnosis and treatment allows us to slow down the disease and prevent blindness in most cases. Having glaucoma today is, with no doubt, much better than having it many years ago or decades ago, because the options of treatment have increased and have improved with the years. We have better medical treatments, we have lasers, we have also surgical techniques that can be applied at different degrees of the disease. So with no doubt, it is possible to treat most cases with glaucoma, and it is possible to help most patients with glaucoma if they are diagnosed on time. There are recent developments in glaucoma surgery that are globally called MIGS, or minimally invasive glaucoma procedures, and among them there is eye stent implant and other techniques. It's not the only one, and these MIGS are useful certainly in some cases. I usually indicate MIGS in patients with early glaucoma when they need to undergo cataract surgery. And in those cases, I do believe, and it's demonstrated with studies, that using glaucoma surgery as a moment to perform these mixed procedures can decrease the need for medical treatment in the following months or years. In most cases, patients require less medications, and in some cases, they even can be without medication for a certain time. Early treatment for glaucoma is very important if we consider that the aim of any treatment is maintenance of the quality of life in the patient. So there is no doubt. if we are able to diagnose the disease and treat the disease earlier, adapting the treatment individually for each patient, it is easier to prevent visual impairment and to maintain quality of life in every patient. It is very important for patients and for clinicians to participate in this World Glaucoma Week to increase the awareness about this disease that is not so well known about population in general, and it's a disease that we can treat adequately in most patients if those patients are identified and a treatment is initiated soon. It is very important for the vision of patients with glaucoma that they are diagnosed as soon as possible, and the only way to do that is early diagnosis and progressive and continuous checkups in those patients at risk.